Hello, my name is April Abeles, and my topic for my presentation today is the efficiency of cognitive behavioral therapy for panic disorder. I'm going to start off with the definition of panic disorder. Panic disorder is characterized by panic attacks, which are brief, intense periods of fear. People who experience panic attacks may explain them as if they are going insane or as if they are going to die. People with this disorder are usually just having physiological sensations, and they are perceiving them as catastrophic events. For example, say a woman has a heart flutter and she perceives it as a heart attack. And it leads her to a panic attack. After her first panic attack, she begins to fear more panic attacks, and this fear brings on panic attacks, and it becomes panic disorder. So one of the treatments we're going to talk about is cognitive behavioral therapy. And cognitive behavioral therapy is the combination of cognitive therapy and behavioral therapy. The idea is that our thoughts determine our emotions and behaviors. So if we take the example of the lady with the heart flutter, she thought she was having a heart attack, so she became fearful and scared, and then she had a panic attack from it. So how does cognitive behavioral therapy work? What's going to happen is you are going to be assessed by a therapist, and that therapist is going to inform you and educate you on the origin of your panic disorder, where your panic attacks are coming from, why you're getting them. And once you are educated, you can begin to learn that they are not dangerous, and therefore you can begin to calm yourself. It also involves calming techniques and usually homework they will give you. They will give you homework to take home and practice the calming techniques and things of that sort. So some advantages of cognitive behavioral therapy include there's no more medication. Some people who have panic attacks are taking medication 1 to 3 times a day. These people may be dependent on it. If they run out of their medication, they may have panic attack, and they may, freak out about it. And it's not good to be dependent on a medication. So that's one of the biggest advantages of cognitive behavioral therapy is it involves no medication. Cognitive behavioral therapy is not a long-term therapy. It's going to be rather short. So that's another good thing. You're not going to have to worry about it being long-term. It's very short. Other advantages, there's low risk, low side effects. The relapse rate is low, which is relapse rate is how many people for instance, go back to having panic attacks. And the low relapse rate just means that once people have had their cognitive behavioral therapy, they're panic attack free. A lot of them become panic attack free, and they're not relapsing back to where they were. They're not relapsing back to that point that they were. Now they may not be completely cured from it, but a lot of people are better, and a lot of people are panic attack free from cognitive behavioral therapy. Some disadvantages of cognitive behavioral therapy are, even though the therapy is a short-term therapy, it may be time-consuming at the time of therapy. For example, you're having to go in for, say, weekly sessions. Maybe it's once a week, maybe it's twice a week. And that therapist is more than likely going to give you homework, like I said earlier, things to kind of study, calming treatments to teach yourself, things of that sort. Another disadvantage is the therapy may be expensive. Maybe you don't have insurance, and maybe your insurance doesn't cover it. So that's one of the disadvantages of the cognitive behavioral therapy. It may be cheaper to be on medication. But the advantages outweigh the disadvantages. If you would notice, the disadvantages were not related to the therapy itself. They were related to money and time. So I really think that the advantages outweigh the disadvantages, because the people who use cognitive behavioral therapy for their panic attacks, a lot of people come through and they don't have panic attacks anymore, and they have such a low relapse rate that really, I think it's worth it. I think it's worth the time and the money to be free of panic attacks, because it is such a disabling thing. And that's where we want to be. We want to get to no panic attacks, and you can't do that with medication. You are dependent on that medication, and the medication is what is making that panic attack go away. You need your thoughts to make your panic attacks go away. So that is why cognitive behavioral therapy is one of the best treatments out there for panic disorder.